HERO's research is partly embedded by our HERO Scorecard in cooperation with Mercer. So the HERO Scorecard is up to almost 3,000 companies have filled out this best practices scorecard about how the way I organize my wellness is consistent with or different from how other organizations are doing it. They can compare their HERO Scorecard data about with sectors like theirs in terms of how well they're ranking. What we find on this question of integration, because we ask it, is
Yeah.
that only about 25% of all these companies who are pretty activated just because they want to fill out the scorecard have written strategic plans. And we find also with some regularity that those with written strategic plans are more probable, more likely to be able to mark that they've had some health improvement impact on the population or even some cost impact relative to the business outcomes. So we hammer at that step in terms of we don't just say do it more comprehensively, do it more strategically and integrated. We say do it with a plan, have a plan. And anytime you ask, most organizations, do your wellness people plan with your safety people? And do they plan together with the EAP people? As you know, as someone who's put together these vendor summits for years, the answer is usually not very impressive in terms of the coordination and planning.
Well, I think it's a great takeaway, actually, that it seems daunting, but step one, you're going to work on a plan if you're the wellness leader or whoever you are. And by the way, I'd like to invite some people from the other groups to help me on my plan and have some input. Who's going to fight that? And then you start the conversation. So engagement in these programs and services has been such a push and such a challenge. I don't know whether the answer is maybe some of the shift towards a patient-valued, patient-centered approach or what it is. But do you have a quick thought on this issue of we provide all this great stuff?
Yeah.
And gosh darn it, people don't use it. What's wrong with them?
Yeah.
I give them tons of money. I do everything I can, and they still won't play.
Let me give you the academic answer. I used to be a health education teacher. The definition for health education, if you look at a textbook definition, is any combination of learning experiences designed to facilitate voluntary adaptations of behaviors conducive to health. So a couple of key words there that I tried to emphasize. It's combinations of learning experiences. There's not sort of a program or this one size fits all thing. You've got to keep asking, what are you interested in? What do you want to do? The voluntariness thing is a pretty big deal. As a health coach who could, just go from one phone call to another, of people who volunteered to say, I want to talk to a health coach because I got work to do on my weight or my stress or whatever it was. I found that I was pretty busy just with the volunteers. I didn't need to go drum up everybody in the workforce. I wanted to work with them when they wanted to work with me. I did not want to work with a smoker who did not want to quit smoking. That's not sort of how our profession works.